how do we really make sure that we provide access to everybody and we encourage uptake from everybody when it comes to using those wellbeing resources? Because some people are so proactive at taking what is there and really actioning it for themselves. But others might never know that they're there. And if they do know that they're there, they might not necessarily be galvanized to take action and implement some of these frameworks or tools for themselves. So what else have you seen be used to really encourage people to use those wellbeing resources? And why is a broader approach necessary?
I think this is $1 million question, Jo, because engagement in communication and in resources is such a challenge across a distributed workforce. And how do you monitor that and kind of measure it? And then you've also got things like age demographics that are barriers to accessing resources. So I think one of my views from quite early on was that there is an element of self-management, and that is through education and awareness. And you've got to take this integrated approach alongside your HR teams, because if we're talking about an HR process, we need to look at both strands. We need to say, there is a lot of resources. What are you as an individual using to support you in this situation? Because it can't all sit on the employer's responsibility. The employee has to have an element of, what am I doing to help myself? Where the employer needs to look at it from their risk is when they are impacting that. So are they exacerbating? Are they taking away the autonomy? Are they putting too much demand on an employee who is struggling already due to stress and mental health? How to bring people along on that journey with you and get them to engage. I think it needs to be authentic. It needs to be a movement. It's not one person's role. It's not the role of myself as wellbeing manager. The champions are important. The other networks, so whether it be the LGBTQ+ or the identity network, they've got a strong tie into mental health and wellbeing. So it shouldn't be done in isolation. It needs to be integrated. Integrating it with the safety approach really starts to see it as a behavioral thing and not just read the nutrition booklet because, you know, it's January and everybody needs to make sure they cut out and look after their bodies. You know, it needs to be more than just one webinar, one booklet on sleep. It needs to have that golden thread. I think will get more people to buy into it and believe it. And consistency. It's not a sprint. I mean, we're doing this because it needs to be sustainable for the people coming through the door so that it's not such an uphill battle. In 10 years' time, it's normal.